Hello, everyone, and welcome to Peace Over Pixels. This is my new project that I started recently. A little background is I, after quitting porn, I found some peace, and that's why I want to help other people find the same peace as well. And today I have psychiatrist and my very good school friend, Dr. Rishav Koirala, with me. He's a returning guest, and I thank him for uh, being in this podcast, this YouTube show. And he's going to break down the brain science behind addiction. That's the topic, brain science behind porn addiction. So, welcome, Rishav. Thank you for
Thanks,
joining.
Rajat, and
Okay.
hi to everyone.
Yes. Okay, let's get started. Well, before we start actually uh, into the brain science and the serious stuff, since I quit porn, people ask me like, okay, Sazag, how do you quit porn? Okay, so I tell them it's simple, 5 seconds. You just close your eyes, lock your phone, and go to sleep. That's the answer, because and that's a 5 second answer for people whose attention span is decreasing from 45 seconds. So this is a 5 second summary. If you can do that, close your eyes, go back to sleep. That's the uh, that's the ultimate solution. But anyway, to get to the serious stuff, we have real psychiatrist, Dr. Rishabh Koirala, to explain how the brain actually works. So, Dr. Koirala, let me start with it's a number, it's a survey that says that 56% of divorces they um, they are due to porn addiction, excessive obsessive use, interest in porn. That's a key factor. This might be a little exaggerated, but still, my question is, why is the brain prioritizing pixels over partner, and what is actually breaking or happening inside these marriages, even though if it's not exactly 56%? What do you think?
So we cannot jump into conclusion, and I must say that a single survey cannot be taken as a strong evidence linking casualty. It might be a coincidence, but still there has not been detailed studies which can claim that okay, this percentage of marriages or divorces have occurred all because of pornography. So and just coming to conclusion is not the right idea, but it does have impact on relationship, not only marriages but relationship and personal life. So I think we'll be talking about this in detail later on.
Okay. And before we dig into the science behind porn addiction, let's address the elephant in the room. That's what they say. Why is there so much stigma around porn addiction, and even among mental health professionals? It's not that much talked about. So can you explain a little bit about this stigma?
Yeah. So to start with, porn addiction, that's not an official term or diagnosis given by any guideline in the world. We follow two major guidelines in the world. One is diagnostic and statistical manual given by American Psychiatric Association, the latest version 5G, fifth text revision. So I have had the privilege to be one of the contributors for that too. And there's another manual which is given by WHO, the ICD-11, the latest manual. So both of them do not use the word porn addiction. So there are other ways. DSM-5, yeah, it doesn't address that. ICD-11, it has included a diagnostic term, compulsive sexual behavior disorder. So what you are talking about, we rather use the term um, problematic pornography use, PPU. So that is moreover an official term or more clinical term than just saying porn addiction. We don't call it porn addiction. Now, coming to your next question, that why is there such a stigma behind it? And and even among mental health workers. So there's a lot of things that culture shapes how a person's thought process saves things, how people view things. So the first thing is we should be aware about, we should not pathologizing, not making any kind of sexual behavior or regarding any sexual behavior directly as something uh, like an illness. So we have to keep that in mind. Second, one major thing that comes in play when we are talking about problematic pornography use is the moral and religious guilt. I think that has changed the whole scenario how people view pornography as. They enjoy it. It is widely and highly used, but at the same time, they bear that moral cost. Many people they bear that cost, and not only the users, but also experts who deal with this, or experts to whom the users come with seeking help. They might also be like um, influenced by these moral values. And third important thing that leads to stigma is the lack of definition. As I mentioned earlier, APA hasn't even defined it. And ICD, WHO has defined it as compulsive sexual behavior disorder, but still we haven't gone in depth regarding porn use and its impacts as much as it is needed. So this lack of consensus also leads to stigma. Apart from that, a common misunderstanding that high use of pornography is directly linked with um, problematic is thought as problematic use, or people say they come to me and they say, I'm a doc, I'm having porn addiction. So why? I just ask them and they say that because I'm using it excessively. But interesting thing is, if there is no impairment despite using it excessively or for some hours every day, we cannot define it clinically as a disorder or an issue. You see, it depends. It's more of a like a Gaussian curve. If you see, some people enjoy sex quite a bit. Some people have several sex several times a day also. But you cannot just label having sex several times a day or masturbating several times a day as a
Mhm.
disorder, just because the frequency is high. There should be some associated factors, which we'll be discussing later, when we say that it is a problematic use. So these all things, along with lack of limited training among experts, psychologists, psychiatrists, um, regarding sexual behavior, sexual disorders, that also leads to this stigma. So I think all these factors come in play when we are talking about how things are used, or when we try to describe uh, use of pornography in a problematic way.
Mhm. Okay, looks like this field hasn't been. It's not clear as black and white. Like, okay, this is exactly what porn addiction is. So that's why there's some stigma, I guess, some confusion as well. So the studies and research is still going on. Uh, this looks like that's what's happening. Which brings me to my next question. So what exactly is porn addiction from a clinical perspective then? And how is it distinguished from high frequency use that is not problematic?
So mental health, when we talk about mental health and human behavior, it's not black and white. The, it's full of gray zones. Normality and abnormality cannot be demarcated by a single line. When you cross the line, you could call it abnormal, and when you don't cross the line, when you are in the other side, you call it normal. So as I mentioned earlier, throughout the conversation, I would rather use the word as problematic pornography use, or problematic use, rather than porn addiction, because as an expert, I would not support the word porn addiction. So when we are talking about problematic pornography use or compulsive sexual behavior disorder, so this comes inside sexual behavior disorder according to WHO. So one important pattern is there is persistent pattern of poorly controlled pornography consumption. Mark my word, it's poorly controlled pornography consumption. I'm not talking about high use pornography. So there is difficulty in regulation of use of pornography. A person might be watching pornography 2 hours a day, and he might not find it poorly controlled. And a person might be using pornography for 10 minutes, and he might be having a lot of problem with that. So the second person will come in this group. And second important point is this use should cause significant distress and impairment of daily functioning,
Mhm.
whether it's in personal level, sometimes even the guilt, or that use creating an emotion leading to anxiety or distress, or family relationship. For example, a person might just watch pornography for 15 minutes, but that person might not, that might hamper his sexual relation or her sexual relationship with the partner. So that leads to dysfunction in relationship or occupation or social relationship. So if there is any impact on this part, then we can say there is significant distress in daily functioning. And third point is, according to ICD-11, this problem should last for at least 6 months. So these three components, if it is there, then we call it compulsive sexual behavior disorder, which also include use of pornography.
Okay. So I think this question is already answered. Then, at what point does porn use become a disorder?
Mm,
So, like you said, about 6 months, continuous use, uh, kind of
oh,
more of a compulsive behavior that
yeah.
leads to that you can diagnose yourself as um, the with this disorder. Then.
Yeah, not only compulsive use, there is also impairment of your functioning. That use has impacted your life in either there is socio or occupational dysfunction due to that use, and it is the same criteria for everything, whether it's gambling, it's gaming. So these are compulsive behavior disorders. So sexual behavior also comes under that.
Mhm.
Yeah,
So you're drawing a parallel between, let's say, other gaming or gambling and all that. So you
exactly.
mentioned social dysfunctioning, something. Can you explain a little bit more about that?
So the thing is, a person can it's normal for a person to use pornography. It's normal. Normal for a person to gamble within limits, or enjoy gaming. But
Mhm.
when that disrupts your daily life, there we can um, when we talk about daily dysfunction, it can be either due to either social dysfunction, either in terms of relationship with your partner, when we talk about pornography, or your daily communication. Second thing is, your for example, if you start um, hampering your work just because you want to watch porn, that really points out towards dysfunction. If you stop prioritizing your work and prioritize watching pornography, then that is dysfunction in your work. So that that should be noticed. If you are using your spare time or your leisure time to use pornography, if you don't feel guilty about it, if it doesn't disrupt your personal relationship with your partner or sexual behaviors, then that's fine. Then that's fine. We don't call it a social or occupational dysfunction.
Mhm. Yeah, correct. Yeah, just like in moderation, let's say alcohol or anything like that.
Exactly.
Many people in the world they consume that, right? And the thing I learned is don't judge people from you as well. You said what you don't know what the other person is going through, right? So
Yeah,
from last interview, I still remember that. And don't judge anyone just because of that. And that's very
exactly.
important. Having some empathy. Yep. Okay, so one thing that reminded me is for work, hampering work. So since there's so many people working from home, I see news and all that, or even like some video that showed that uh, the person was watching porn in at work. So that was viral video.
Yeah,
So that kind of reminded me, if you're, if you're alone and then you can watch porn and you can work as well. So that creates kind of like a very easy environment for the person to consume porn, right? If your mind is not
Yeah,
in the right place.
you just don't need to be alone. You can you use it with your partner in a consensual way. If you
Hmm.
enjoy, if you it in sometimes porn can enhance your sexual life for good.
Hmm.
If it's consensual, if both of you enjoy and use porn in that way, then there's no harm. At least till now, we don't have any evidence that suggests that that is harmful for us.
Hmm.
Yeah.
Yes, I think they might, I might do another episode of just the benefits of porn, right? Because
Yeah.
there might be some benefits, like I don't know,
Exactly.
different positions, sexual education, whatever, you know. So
Exactly.
there's
Sex
two
education.
sides of both. But since it's those are, if people are good with it, there's no problem, right? We wouldn't be trying to help them. It's for those who have the problem that we're trying to help.
Yeah.
So the second section is brain science and consequences. The question is what happens actually happens to the brain of I'm using the word again, porn addict,
Mm.
or the word that you're using, the the
Problematic porn use. Problematic.
problematic porn
Use.
use, yeah.
Yeah.
So for the sake of simplicity, let's just call it porn addiction. So what happens in the brain, uh, according to you?
So evidence, there has been limited evidence still, because when we say evidence, we just don't base um, on one study or like few papers or few studies. So we need to explore a lot, but till now, good research have been conducted and they have shown similar results like in any other addictive disorders. So when we talk about problematic use of porn or um, uh, compulsive sexual behavior disorder, the reward system hypersensitivity has shown to increase. There is increased in blood flow in reward system. That's ventral striatum, orbitofrontal cortex. These are the organs that deals with reward system, and every form of addiction leads with that. So that has been seen that there is increased blood flow and there is decreased prefrontal or striatal connectivity. So prefrontal lobe is the lobe that controls us. That's quite developed in human beings. Prefrontal lobes that controls our impulses. So
Mhm.
it has been seen that there is decreased prefrontal and striatal. The relationship between reward and control, there is some problem in the connection. So that has been seen, and it has also been seen that there is problem in tolerance. Like any other addictive behavior, um, tolerance means and use and play. For example, on the first, if you are drinking alcohol for the first time, you might get intoxicated with a glass of alcohol, or you may
Mhm.
feel bit good with one glass of alcohol.
Mhm.
But when you use it regularly, your tolerance increases, and
Mhm.
then even after use of 2 to 3 glass of alcohol, you don't get the same high
Right.
or same trip. So it's similar to alcohol. The porn use also might also be similar to alcohol if it is not used in a regulated way. If the consumption is high, then the stimulus or the excitement really like comes only after consumption of large amount. So
Mhm.
despite saying this, we have to understand that we what we don't know is that the popular internet claims about dopamine burnout, brain
Mhm.
damage
Mhm.
because of porn, or
Yeah.
they say that porn destroys receptors in brain. So that is
Mhm.
not evidence based fact. And even there is a technical thing like delta force B, which is says they say that it accumulates in nucleus accumbens. So this is also not proven for pornography use. This that has been studied in animal models, and this has been related in other forms of addiction. But though they relate this with they say that delta phosphate causes permanent changes in human beings when they use porn in an unregulated way. This is not a evidence backed claim. So we have to keep it this in mind.
Okay. So which leads to the other question. how does porn addiction affect the prefrontal cortex? I think you answered that.
Yeah,
So
that I
prefrontal
heard
cortex
you.
is the one that makes the decision, right? Impulse
Yeah, it
control,
controls
is
the
that the one?
impulse, so it regulates us. So increase because of the excess porn use, there might be increased impulsivity. A few research have supported this. There is reduced inhibitory control, and there is difficulty in resting cues, like understanding cues also, where you
Mm,
should. Yeah.
okay. And the other one is, what are common symptoms of withdrawal? Just like in alcohol, it says withdrawal pause, brain fog, irritability, mood swings.
Okay.
Yeah.
So this is also an important point. What we have to understand is, like, substances such as alcohol, opiates, or benzodiazepine, like
Hmm.
drugs that cause addiction. Withdrawal syndrome, physiological withdrawal syndrome, has not been defined for pornography use, or what you are saying as porno addiction. Therefore, we don't use the term porn addiction because we haven't come across any physiological withdrawal syndrome. But studies have shown some withdrawal symptoms rather than syndrome, like, so, for example, craving and tolerance. Studies have found that there is increased craving, increased tolerance. Described tolerance earlier. That might be there. And there might also be, when you abruptly stop use of pornography and you are using it excessively earlier, then there might
Hmm.
be some behavioral changes such as irritability, restlessness, mood changes, decreased concentration. And what we have to understand is these experiences are real, but they are not equivalent to substance withdrawal. So, what many people use the post acute withdrawal syndrome, the PAWS, that is not established for problematic pornography use.
Okay. Okay. And how does porn addiction impact real life relationships, intimacy, sexual performance, or it's called PIDE, porn induced erectile dysfunction?
Okay. So, problematic pornography use has been associated with sexual function impairment and sexual
Hmm.
dissatisfaction in small group of people. And um, it does impact, like, intimacy, and it might create interpersonal conflict when there is no consensus between two
Hmm.
users, like partners, when one is using pornography excessively.
Hmm.
But and they have also studies have shown that PPU carries a sexually coercive behavior, intimate partner violence, and even elevated suicide ideation in very severe cases. There are, like, these are case examples. Um,
Okay.
and another thing that you mentioned, porn-induced erectile dysfunction, PID.
Hmm.
So this has been studied, but um, this this is not clear. Like, erectile dysfunction might not just be because of excessive pornography use, but we have to keep in consideration that there might be other factors associated with this. Because till now, what we haven't discussed is problematic pornography use might not be an isolated issue. There might be other issues related to that. Like, we talked about prefrontal cortex. People with PPU have been seen to have ADHD, difficulty in emotional regulation. It might be a form of self medication. I've known patients who say that when they are stressed, they use pornography. So, depression and anxiety might also lead to PPU, just like depression and anxiety, might lead to excess use of alcohol or drugs as a form of pleasure seeking behavior, just to subdue your emotional stress or emotional dysregulation. So, erectile dysfunction might not only be an outcome of PPU, but we have to reconsider comorbidities when we're talking about this. So,
Okay.
because erectile dysfunction is one of the symptoms, not so common, but it might. We usually encounter this in depression and anxiety, so we have to think about it.
It could be various underlying issues, not just porn addiction
Not just porn addiction, and
for
even,
erectile
like,
dysfunction.
person, people who are into PPU, problematic porn use,
Mm-hmm.
they have shown to have substance abuse also. And substance abuse also causes erectile dysfunction. So we have to consider things as a whole rather than
Mm-hmm.
blaming just pornography use for erectile
Mm-hmm.
dysfunction.
Yeah, like not judging right away, under looking
So
at
we
it in detail.
see
Yeah,
things in a holistic way. Yep.
yes, exactly. And the other question, a little bit background would be good. So usually men are, it's like normal for men to watch porn, and that's what the society has developed over the years. Men more sexually, whatever they do or watch porn, that's kind of normal. But for women, only these days now, it's kind of we're getting equal rights and everything like that. So basically, the question is there a difference in how men and women are affected with porn
See, the
use?
whole cultural thing and whole the concept of pornography, it was moreover directed towards men, like for men. And later on, people understood that you cannot just say that the pleasure is should be limited to men and not for
Right.
women. So these things came up, and still now, when we talk about studies all over the world, one important thing is men are the main consumers of pornography through in the world,
Hmm.
and that also leads to the difficulties faced due to excess pornography use. So studies have shown high prevalence in like they say, like the prevalence has ranged quite a bit. I studied a lot of papers before coming to this show, and some studies even showed 25% of PPU in people using pornography. So, but some say showed very less, like 0.3%.
Hmm.
On an average, there was a very good systematic review that was done in 2024. Systematic review mm, is a review of all the papers that has been published
Hmm.
for pornographic porn use. So they do like related to the topic. So what that has shown is around 4 to 11% of people using pornography, they have problematic porn use. Men have problematic porn use, whereas 1 to 3% have of women have problematic porn use. So this fact might be influenced by other things, such as women being hesitant to share about, in some cultures, share about
Hmm.
their personal sexual life, and because this is a worldwide study, and but we still need like more evidence to back this thing. But till now, evidence suggests that men you have suffer from pornographic use more than females.
Okay. Now moving on to the third section, it's pathways to recovery. The question is what actually works in treatment, like CBT, ACT, 12-step coaching.
See, when we talk about recovery, we have to understand what are we, what are the issues we are talking about. And when we considered, is it just pornographic use or dissatisfaction with the pornographic use, or are we talking about illnesses, disorders, such as compulsive sexual behavior disorder, pornography, problematic use? So till now, evidence there has not been huge studies, but till now, evidence suggests CBT works the best. It has the strongest evidence. It works by trigger identification. It works by relapse prevention. There is also ACT, acceptance and commitment therapy. So increased psychological flexibility due to use of ACT and reduced um, reduced experimental avoidance. That means like there is OS management with the use of ACT. So that also helps to reduce pornography misuse. um, Mindfulness based media interventions where they increase awareness about urges, and where they teach us how to control our reactive behaviors, that has also shown evidence. But 12 stress programs, they don't have any RCTs. They are like anecdotal studies that say that okay, this might be helpful, but we don't have strong evidence. So These all are useful for um, um, disorders or where there are major issues, but there has not been like studies where coaching have been helpful for um, disorders. But I can say that this can make coaching can be used as an adjunct for subclinical concerns. Obviously, coaching cannot be a replacement for expert expert treatment or expert care, but it can be used as an adjunct.
Okay. So which brings to the next question: if there is this condition that we are trying to treat, then how long does the brain take to heal after quitting porn? What's a realistic timeline?
So,
You turn the light on.
mm, okay, the honest answer is like there is no like we do not know because this is not a specific thing. It is controlled by several factors: severity of use, severity of
Hmm.
impact, the problematic impact on the person, underlying psychopathology. Because we mentioned earlier, problematic pornography use is not an isolated thing. There might be other stuff related to it. Example, disorders, mental disorders, substance abuse, even the personality of a person. So novelty seeking personality, it has, the studies have shown that people having novelty seeking personality, they are more into addiction as well as pornographic porn. They might be into pornographic problematic pornography use. So relationship factors, whether the person is getting good support from the partner or not. So
Hmm.
whether the person gets good engagement with the treatment or not. So these all factors come to play. And I've heard about that 90-day reboot claims that, and the no fab communities have claimed that in 90 days the things can recover if you go through such and such process. But this is this can be individualized, but this is but this is not, this cannot be generalized, and this is not totally true also, because I mentioned so many factors come to play, and we cannot just claim that okay, this will, a person will recover after. It's not like antibiotic use when you say, okay, if the person is having such and such problem, most of them recover after 7 days of antibiotic use.
Right, right. Yeah.
Uh,
Yeah, it's not like a magic pill that you take and then
Yeah. So it's
it's different factors based on the patient, So,
compliance,
uh,
behavior change, and so many things come to play.
mhm. Yeah, so I quit porn, right? So
Yeah.
so I can share my lived experience. So
Yeah.
it was, for me, it was shame and guilt, right? So I but if someone else is trying to do the same thing, like I said, jokingly, put away your phone and then go to sleep. That's exactly what I did, and that's what people do usually. They're on their phone alone at night and then keep scrolling. But if everyone can do that, yes, that's the answer. But that's not the answer for everyone, right? So uh, behind the scenes, there's different things going on. Why they're watching it, the various reasons, like you said. We can't just. It might not even be porn. It could be trauma or various
Yeah.
other things going on in their life. So there's no one size fits all. Basically, is what you're saying,
And
right?
like you mentioned earlier, you said that, and that struck me that yeah, it's more about shame and guilt. So I was like, it might be that you were not having problematic phone use. It was more over this moral thing that had come to play. No,
Yes.
it's true. It's true. That's
Yeah.
what I have been discussing. It
Right. Right.
might not be problematic phone use at all. It might just
Hmm.
be just moral guilt that
Hmm.
has been ingrained because of our culture and our experiences from the past. So
Hmm.
I'm not saying like it's similar to alcohol use. You see, people
Right.
use alcohol everywhere. Some use it culturally. Even in Nepal, there are some subgroups or some groups of people who used alcohol in their culture. It's a important part of their culture, whereas some don't even touch it.
Hmm.
You cannot just say that alcohol is used. If someone uses alcohol, it's harmful. It's addiction. Though WHO has mentioned clearly that even a drop of alcohol is harmful. So we cannot just say that a person is into addiction just because they are using it. And
Hmm.
we cannot just ask a person to quit alcohol because WHO has said that has told that it is harmful. It's like it's a person's choice. It's a human right thing. So when we talk about problematic porn use, we cannot just say that if a person is feels morally guilty about it, that means that that is doing harm in like to the level of problematic pornography use. Obviously, it's harming that person because that person is feeling guilty. It is creating some form of anxiety, but we have to explore how is it just lack of education, or is it just is it associated with other symptoms also?
Hmm. Yes, yes. So, yeah, I brought that up since since I was saying like every person has their own reasons, right, and the choices,
Yes.
and so shame and guilt, it came after 43 years only. It's like a calling. So it's no one can stop anyone from watching, whatever they would like, right? It's
Yeah.
a personal choice.
Personal.
And that was mine. And after quitting, the peace I got was it outperformed, like outweighed everything else. So that's why I stuck with
That's
it,
very
just like
nice.
alcohol. Yeah.
Yeah.
So I think it's effect. I quit alcohol, and then after a year or 2 years later, I quit this. So maybe something is happening with my brain. You can do a scan and check.
It's more
But
about
I
you are trying to come out of your addictive behavior probably. So
Mhm,
it's a good thing to have more control on yourself if you feel good about it, and it's more about your individual thing. So I support your point of view
mhm.
in your context. Yeah.
Yeah, exactly. Thank you. And okay, so if someone wants to come out of it, then when should someone see a psychiatrist like yourself, or a therapist, or a coach like myself, whom I can guide as well?
Yeah.
Because there's no clear thing on who the person needs to go to. Let's say a person comes in, they think, okay, if I quit, then that would be beneficial for me, or if they have the problematic porn use, then what's the first step, who to see?
Okay. So first of all, you have to understand what problem you are facing. First of
Hmm.
all, you have to at least you can self-diagnose to some extent.
Right.
You have to see whether there is persistent pattern of poorly controlled pornography consumption or not. First point. Second, is it impairing your daily function, either socially, occupationally, or emotionally, personally? So if the second point also means, and we explore whether it's one time use, you used it, you feel guilty, or is it a continuous use. We mentioned a 6 months criteria given by ICD-11. So
Hmm.
if these all criteria meets, then we have to understand you meet the criteria for problematic porn use. Now you check the intensity. If there are associated anxiety, depression, if there are associated other problems also, such as substance abuse, ADHD, then the best person, PTSD, trauma, then the best person to visit would be a psychiatrist, if accessible, along with a psychotherapist. If the distress is less, if PPU is there meeting compulsive sexual behavior disorder criteria, but there is impairment, but it is in moderate level, then what you can just visit a psychotherapist and see if that can help, and that then can help you deal with this. But things are not to an extreme level. If there is mild distress, there is no impairment, and as you mentioned earlier, if there is moral incongruence and you want to quit, then the coach might be the right person. You don't need to go to an expert.
Hmm. So it's more of a behavioral discipline thing than
Yeah,
coach can,
yeah,
because the
yeah,
brain and all, of course, psychiatrists like yourself,
yeah. Disorder.
psychotherapist and therapist, is that the same thing or different things?
Yeah, it's the same thing. Psychotherapist, like therapy might be a therapist might be a physiotherapist, a natural therapist, but
Okay.
psychotherapist are therapists who deal with psychology. Yeah,
Hmm.
and who conduct
So yeah,
psycho.
that's what I thought. The more deeper the issue, the more distress there is, then visit a psychiatrist and
Yeah,
so on.
yeah.
Yes. I think the this question you pointed out, you discussed a little bit already. How do you address underlying issues like trauma, depression, ADHD,
Yeah.
and this, and I'll combine that with the role of meditation, like you mentioned last time as well. I do meditation myself.
Mm.
Exercise, medicine, like you said last time, for mental health in general is
Mm.
very good, like you said. So, what role does meditation play for this?
See, man, I haven't come across any studies where they have like strong evidence where they say that meditation has big impact or like it helps in recovery of PPU. But
Hmm.
obviously, like any addictive behavior, meditation can have good role. It increases self control. It also helps you focus. It helps control. For example, we talk about mindfulness and acceptance based therapy. Mindfulness based therapy, even acceptance based therapy also comes from a bit of mindfulness. So that has indirect role in controlling your emotions and your urges. So I think
Hmm.
if you can practice meditation well, then it might also help you control your urges and in turn help with your problematic porn use. And we have to, and I would also like to talk about a bit about medication. Though there are no FDA approved medications, pharmacotherapy, but we do use some medications such as SSRIs. We use
What is that?
naltrexone.
What is SSRI?
SSRI is selective serotonin reuptake inhibitors. These are like fluoxetine, sertraline, Zoloft, escitalopram, Lexapro. That's commonly
Hmm.
used in US also and throughout the world. So these medications have shown to have some effect, though it is not RCT, like there has not been RCTs conducted on it.
So,
And
what does it do? What does
it
it do exactly?
controls your emotions. It controls your emotions. If there is more of a compulsive behavior, it helps to control that compulsive behavior. And if there are associated anxiety, depression, which like have been perpetuating those pornographic behavior, like compulsive use, then it also controls that. And there's another medication called naltrexone, which is used for opiate and alcohol dependence, FDA approved. And
Hmm.
this naltrexone has also been used in gambling disorders. And some of the psychiatrists they have and researchers have also explored use of naltrexone on PPU, and they've shown some evidence for that, like mild evidence, but there's not strong evidence. But this can be used off label if needed in case of severe cases.
Okay. Okay. Yeah, that's interesting that
Mm.
this can manage uh, this behavior and to a certain extent.
Yeah.
Okay, now moving to the next section, the more modern challenges. This is going to be very interesting. AI, right? Everyone talks about AI, AI, AI all the time, and let's talk about that as well a little bit. How is AI generated porn, right? AI generated porn like deepfakes. There's nudify apps, AI girlfriends. I don't know how that happens, but I guess it's some like AI, whatever you wish it'll be there. And yeah, so how does these AI generated porn? How is it changing the addiction landscape compared to actually the real porn?
So you have to see it in a holistic way. AI has been a part of our life. So people, the younger generation, are more like they have AI has integrated in their life more than the older generation. And it is not only pornography, but it is there in everything that we do. We write a passage, we communicate, we ask questions, we
Mm,
create some, even in art, to
yeah.
uh, each and every aspect of our life, directly and indirectly, AI has penetrated.
Hmm.
So AI has also penetrated our emotions. For example, I recently went through a study where they said that 1 out of 5 teenagers
Hmm.
are using LLM, whether it's ChatGPT or
Hmm.
other DeepSeek,
Yeah.
to resolve their emotional issues. They use it as a therapist. So same can be, there can be a twist to that. So
Mm,
if you can use AI or LLM to share your emotions or to find comfort from your stress, then obviously,
mm,
you can also use it to find pleasure. Uh, l-
mm.
the examples you give
Yeah.
is the same, is the same thing. So
Mm,
I think this is just a change of our human experiences, and we cannot just say that okay, this is going to be worst, because if a person is not able to find a girlfriend
mm,
in real life because of their issues, for example, so my some of them might not able to communicate with the some a boy or a girl might not be able to communicate with opposite gender because of their lots of issues like emotional and personal behavior, then they might seek comfort over there. And who are we to say that that's a wrong way to seek help or support or even pleasure? But
mm,
that should be regulated. That's what I say. And we
mm.
cannot just say right now that where this will turn to, because we don't know about future. So I think regulation is more important. Education is more important. Understanding human emotions, prioritizing human emotions is more important. And this is more about teaching things to people rather than just concluding that this is a very wrong thing to do.
Great. Yeah. Again, uh, have empathy. Don't judge on what
Yeah.
people are doing. Uh, understand their emotions, where they're coming from. Like you said, I didn't know that teens, talk to AI for their emotional needs as well, which is very realistic because it can
Not only
happen.
teens, a lot of
For
people use
everything.
AI like LLM for to share their emotions. A lot of my patients, they say that
Oh, okay.
it's easier to communicate with LLM rather than a therapist because they don't feel judged. But sometimes you might have come across news how this has taken a wrong turn and people have have taken wrong steps because of bad guidance. But I think we just cannot say that this is totally a wrong thing to do.
Exactly. With the times, it's changing. But
Mm.
my only thing is, since I mean till now we are watching real real people. Now it's more morphed into more of imagination, whatever you want. So that's like you said, maybe regulation and education. You got, just like alcohol, you got to be uh, educate them on the good
Yeah.
and bad side, because there could be good as well, right? Going out for a girl, it's dangerous outside, then you can just watch porn and not go through all that danger, I guess. That's that's my take anyway. So that leads to another question. Social media as soft porn. You open your eyes, it's everywhere, even if you don't want to watch it. If you watch it, the algorithm gives you more and more of the same thing. So it's kind of unavoidable, that's what people say. So the more you watch it, it's gonna pop in there. So what's your take on social media as soft porn leading to wanting person to watch more porn, which is a little bit more unnatural, right? Instead of one person wanting, okay, I want to watch this because of whatever reason, human behavior. Uh, this social media affecting this, their decision.
Okay. The thing is, the algorithm-driven platforms, they do continuously expose to sexualized content if you are liking it or if you are using it.
Yes.
But the possible mechanism could be like cue triggering, habit formation, or
Hmm.
continuous novelty seeking. You enjoy the thing and you repeatedly use that thing. But direct causal evidence remains limited regarding this. And I must say that social media may function as a trigger or gateway for vulnerable individuals, but it is not accurate to say that social media automatically cause pornography
Hmm.
addiction. So we have to be cautious about just blaming it.
Hmm. Hmm. Yes, it is leading to the like let's say there's more choices, or like uh, I don't know. Let's say if you put alcohol in your house, then it's more easier to consume it, right?
Yeah,
Based on,
yeah,
let's say, if you
we
don't put
carry
it
the
and you
burden.
go outside, so something like that, it's just there. So
Mm.
it's kind of more easy to access it in a way.
Yeah, moreover, it's individualized thing. See, I have got some alcohol over here, but I haven't drank it since 4 years. So it depends
Right.
upon person to person. But we do advise
Exactly.
people to avoid alcohol
Mhm.
exposure when they are deep into addiction. Yeah, it's
Right.
a
Right. Yeah. Yeah, yeah, that's a good point. Yeah, so for you, it's right there. You don't drink. For me, also, I have my leftover. Since I quit alcohol as well, I go see it every day. I don't feel tempted to drink. Right, so that's a
it
good point.
depends upon person to person. Yeah,
Person
but
to
you need
person.
to
If
avoid.
you're really trying to quit porn, then yeah, that's going to be like, oh, so much of temptation. But yeah, if you're disciplined, then you don't need to worry about that. And the other question is it's kind of uh, disturbing when I read this, like early exposure. So kids these days seeing porn by the age of 8 9 to 11. So this is very unnatural. Like when we were kids, right? It wasn't possible to see anything or get exposure to anything like this. It was not possible at all. So now the uh, the clock has changed, and it's very I feel it's unnatural, and um, for kids to be exposed this way, and it's unavoidable. They have their phones as well for various reasons. So what do you think are the long term effects of this, and how do you see this?
See, the thing is, when we are talking about this kind of things, there's a lot of moral ambiguity that comes into play. How
Sure.
we have been shaped and what we define as natural and unnatural, and we have to understand that the times they are changing, as Bob Dylan had
Right.
mentioned. So, uh, who knows? This might be a natural process that has come with the change of like change of the whole society, and this is an exposure that was unavoidable.
Hmm.
So, but I'm not saying this is a good change. So, uh, early exposure to about regarding porn with children, this brings out bad changes. For example, earlier sexual experimentation, which is not good for children, unrealistic sexual expectations, and
Hmm.
distorted beliefs about relationship also. And another interesting thing is body image concerns also. So, um, despite this, we have to understand that these things, these outcomes are mainly related with family environment, are also related with family environment, education, culture, and peer influences. So rather than fear based messaging to the children, it is generally good to give them age appropriate sexual education.
Hmm.
So I think we should focus on that. And evidence also suggests that open communication by parents, non-shaming discussions, and digital literacy is more important. And in school also healthy sexual education is important to avoid this kind of false information or false expectations, media literacy. So these these things are important.
Hmm. Yes, so that's a good point. Educating open communication parents side, and then sex education in school side as well
Yeah.
is very important. Yeah. So now moving on to the last one, last topic that I jotted down later on that I talked to you about. So people, if they would like some kind of uh, break from their problematic use of porn, and Nepal could be like a good healing center if you uh, put it in that way. They can come in and they refresh their mind with the natural beauty, the peaceful ambience of Nepal. How do you see that as a possibility? The change of scenery. Many people come to Mount, like climb Mount Everest and hiking and all that. As part of that. healing process, could that be introduced for this addiction as well?
So yeah, it's a change of behavior that we want, and
Yeah.
sometimes change of environment also helps people to change their behavior. So in that context, I think that could be one option, like changing environment. A person who is in another country might come to a peaceful and like a country like Nepal where they can have a different kind of recreation, and that might also be helpful. But what we have to understand is. The problem as the whole discussion we have conducted today, it leads to we have to understand one thing is that the problem is not only pornography but related associated factors. And studies have shown that stress, loneliness, anxiety, depression, even trauma, childhood trauma in men, especially in men, impulsivity. So these all things needs to be addressed. And yes, if we get the answer to that or we get a solution for that, then the healing process will be easier. And as you mentioned, coming here and going for a trek could be a supportive thing, but along with that, if there are issues related, as I mentioned earlier, then that needs to be addressed separately too. Yep.
Hmm. Of course, yeah. Yeah, that's what I see as a vision. That Nepal itself, peaceful country from land of Buddha. People always say here as well. We feel so at peace when we go to Nepal. So why not do it, right? If that's possible, that would be a great thing. Help the economy of Nepal as well. So that's for some other for next episodes to talk about. But let me go to the last section, which is prevention, ethics, and closing. I believe you answered this already. Can porn addiction be prevented? And what parents and school need to do, or as a society, which you mentioned already, the open communication with and the school as well, education on that. But anything as a society,
Yeah.
since it's a taboo, a stigma subject.
Yeah. So we could conduct digital well-being programs or mental health promotion programs, even relationship education. Uh, what you are doing is also a step that has been taken by the society to raise awareness about problematic porn use. So these kind
Hmm.
of actions will surely help mm, um, prevent the problematic porn use to some extent. So this should be promoted.
Okay. Okay. Great. And uh, so, like you talk about empathy all the time, right? With the patients, and in the last interview that I watched you were mentioning with the lady. Uh, there's some. I think in the Nepal, the revolution, a kid died, and then the mother was kind of speechless, looking at the kid. She wasn't crying, she wasn't doing anything. So people were like, why isn't she crying like that, right? So you said that you got to be empathetic. You need to know what's going on in her head. So yes, you said she was so shocked that she couldn't accept that reality, right? So
Yeah.
in that context, if let's say someone is addicted to this, right? They have a problematic use with they
Mm.
accept it. Only they know. No one else in this world can prove
Yeah.
that I don't watch porn or you watch porn or likewise, right? If you are the only person who knows that, that person is the only person that knows that, and they accepted themselves, but I am talking about it, and maybe they want help, but what do you think? What is one thing you wish you want to tell them, or wish they knew, if they want to address their issue? If they acknowledge it, then how do you break that cycle from their perspective?
Okay. So what we have to understand is pornography is highly used all over the world. The studies have shown, like one study it might not be so perfect study, but so that Australian men 100% use pornography. So just use of pornography should not be seen as a negative thing. Even high use of pornography should not be seen as a problematic pornography use. And
Mm.
when there is problematic pornography use, as I mentioned earlier, meeting the criteria, we should not just isolate it with just watching pornography. There will surely be associated factors, whether it is with the person's relationship, like person's relationship, or associated personality or disorders, mental disorders, or stress, or childhood trauma. So let's not just isolate it as a pornography use, misuse. We have to see the person as a whole and see their understand like current situation, their environment, and we if they are trying to seek help or if we are trying to help, then we have to help them in a holistic way rather than just stopping their pornography use. That is not going to work. Just stopping the pornography use is not going to work. So let's be clear about what is misuse, what is problematic use, and how to help the person like in a holistic way. I think
Mhm,
that
mhm,
would be my statement.
mhm. Yeah. Every person is different. Like understanding them in detail, in what
Yeah.
basically diagnosing them, and how they can be helped. Basically, okay. I think this question is already you addressed already how psychiatrists or coaches can help. So I don't want to repeat that. But any final message of hope for from your wise words that you want
So
to share?
studies have shown that people get more stressed
Uh huh.
because of pornography use than they should be. You're getting my point?
Okay.
So it's moral incongruence that plays the major role when people think that they are into porn addiction. So
Okay.
uh, being scared is not a solution.
Hmm.
Let's be realistic. Let's understand if it's a real problematic use. Try to use the criterias that will be helpful for you to understand your own issues. And if there is a problematic use, or if there is moral incongruence, and if you want to come out of it, there is help, seek help. That would
Hmm.
be advice.
Okay, great. Yeah, thank you so much, Dr. Koirala. That was really interesting insights for me as well. I really loved it. And for next, I hope you'll come back again for next episode because I have some other interesting topics and follow up to do after this one. So thank you very much and
Thank you, Sajal.
have a great one.
You too.
Bye.
Take care. Bye.